Thank you so much, Jane. It's great to be here. And before we get started, we just wanted to acknowledge Jane, Florian, and the Food Packaging Forum, Justin. We're delighted to be here, and we thank you very much for including us at short notice and very late in the organisation of your event. So thank you very much. We're sitting together tonight. We thought it would be easier, and it is rather late. So forgive us if we stumble over words, because I'm not a night owl. My colleague Sarah is definitely a night owl, though. So our talk this evening will be on plastics and human health, which is our team, and Sarah is the director of our team, and we work for the Minderoo Foundation, and we're coming live from Western Australia, so the west coast of Australia, and from Fremantle, which is right on the coast. So we're a few minutes away from the ocean here. So it's our great pleasure to speak to you tonight. So who are we? So if you want to hear about our team, we have quite the team. We're a multidisciplinary team. In our team, we have scientists, we have communicators and change agents, which is myself. We have legal professionals, we have chemists, we have a paediatrician, Christos Simeonides. We have many qualified clinical researchers and PhD students, as well as some expert data scientists to represent our research with fantastic data visualization. We're very, very lucky to have built such a fantastic team because of the support of our chairman, Andrew Forrest, and chairwoman, Nicola Forrest, his wife. And they are very, very generous and very, very encouraging and supportive of these requirements across many different initiatives. And No Plastic Waste and Plastics and Human Health is just one of those examples. And they are funding, they're a philanthropic foundation, they're funding us to make intractable problems of the world go away. And as we know, plastics is definitely one of those intractable problems, and sometimes seemingly insurmountable. And definitely in relation to food packaging, one of the biggest problems that we face together. So we're very, very delighted to be on this call, and we will get into our presentation now. So this is our team, as I said before, cross-disciplinary. What we're doing, we have two teams. We're very, very lucky to be spread globally. We have quite a presence in Europe. We have a very large team in Amsterdam, and they are called No Plastic Waste. That is their branding. And there's a group of people based in Amsterdam, as well as London and recently the US. And we are, I guess, the Southern Hemisphere. Their team, the other team, their focus is very much about plastic waste, and our team in Perth, our focus is very much about plastics and human health. And I've just put a slide together here to describe the difference between our teams. They are focused very much on the visible waste streams. So you would have seen the recent report on the Global Plastic Waste Makers Index, which received very, very excellent global publicity, and I'll put that in a link so that everybody can see that after the conference, because if you haven't seen it, it's very, very, very clear presentation on the top 20 single-use plastic waste makers in the world, and also identifies who's financing those organisations. So it's very interesting reading, and that team is very much working on visible waste streams and plastic pollution. Our team is working on the invisible plastics. So we are working on the plastics you can't see. They are working on the plastics in the environment, and our team are working on the plastics in the body. That team, as I said before, are working on plastic production and waste, and our team are working more on the polymers and chemicals and additives, which the presentations that have preceded us have been a very nice segue to ours, because very much in the sweet spot of what we would talk about. So their strategies for change are about transparency, and transparency in reporting in terms of financial reporting and reporting on plastic footprints. Our team is looking at transparency of chemicals, so understanding what plastic chemicals and additives are in our body, and also just making them visible, so making the invisible visible. Where we come together is our teams are both focused on recycling of plastic, because we see this as a transition. It's absolutely critical that the world adopts a circular economy model, and sooner rather than later. And it's also critical that we move to safe and sustainable plastic design or alternatives to plastic. So we are very much hand in hand on our work, and we're very much complementary. So just moving forward, whoops, sorry, just 2 seconds. Our efforts are across the board. We have built global networks across the board. We have more than 100 people across the board based in science, clinical research, not-for-profits, legislative people, regulators. We have long and detailed conversations with our not-for-profits, such as the Food Packaging Forum, and other not-for-profits such as Common Seas and the Plastic Soup Foundation. And here in Australia, we have an interesting network called the National Toxics Network, who are part of the International Pollution and Elimination Network. So we're very, very well networked. And I can tell you personally, I spend a lot of time on Zooms, and I'm often on Zooms in the middle of the night, in the early hours of the morning in Perth, to reach out to our Northern Hemisphere counterparts. So what are we doing? We're collaborating to build evidence. It is really important to build scoping and umbrella literature reviews. I think I'm getting a little hurry along. We need to build more evidence. So we're doing literature reviews. We're going to produce a campaign. We need to build more evidence. We've built a laboratory. We've got a partnership with the University of Queensland. We are doing research on the Barwon infant study and other birth and cohort studies. We're looking at exposure studies and neurological disorder studies. We are also we've just done a review on plastic regulation in Australia, and we want to do a global comparison. We're working on a lot of impact work. We're collaborating with global communities, as I said before. We want to partner with industry and design safe and sustainable plastics, and also change policy and law. So we're very, very ambitious. Moving forward very quickly, we have daily contact with plastic products. This diagram shows you all the different contacts we have as babies and as adults across. As you know, plastic is ubiquitous. We're exposed in utero. We inhale this. It's in contact with our skin. We absorb it, and we ingest it on a daily basis. So I'm really sorry to rush, but now I'll hand over to my lovely Sarah.
Thank you, Lisa. So the plastic particles are I just dropped my phone, are the thing that have captured the public's imagination. We hear about microplastics a great deal in the news. And it's not just the particles themselves we need to be worried about, but also the fact that they act as Trojan horses, and they take toxic chemicals into our bodies, not just the additives that are there, but also the adsorbed heavy metals, pesticides, and pathogens as well, some of which are antibiotic resistance. We know, if you look at the chemical literature, that there is evidence for microplastics in the lung, and this is related to interstitial lung disease, which is irreversible. It's the same as asbestosis and the damage that you see after smoking. There's also evidence for some microplastic particles in colectomy samples as well as stools, but we don't know what the health impacts are. And we do know from animal work that inflammation and oxidative stress is a serious outcome, at least. We don't know what's happening in humans. And what about the nanoplastics, these tiny virus-sized particles which can probably get through all sorts of barriers, blood-brain barrier, and melt into our bodies, but we know nothing about how they impact health because we don't know how to measure them. Next slide, please. As Lisa's mentioned, we've partnered with a number of people, including the University of Queensland, where we are developing techniques to measure the nanoplastics in human tissue, particularly very difficult tissue such as human brain, and doing that with the Sydney Brain Bank. And the whole concept behind our team is to build credible evidence for the impact on human health, integrate that with law and policy. And it's no good having this data just sitting in the library. We have to get out there, which is why Lisa is building this network. And we need global standards because we really need to rethink plastic and redesign it so it's safe, doesn't break down into nanoplastic particles, and doesn't release these toxic additives. Next slide, please. So we have done a gargantuan study of the literature. The primary literature is very inconsistent We've looked at the systematic reviews, which is a higher level of evidence. And interestingly, only a very small number. We know quite a lot about a very small number of chemicals. And you can see on the right all the different health effects for which there is consistent evidence for harm, as shown in bold. And if that's not concerning enough, there are a whole host of other changes as well, with just as much evidence for for issues to do with damage to human health. And the list just goes on. And the frightening thing is that there are so many chemicals we have not even started to study yet. This is just the tip of the iceberg. And we cannot, frankly, we cannot keep up. So I think the talk about regulating chemicals on a class basis is very important. So this will be published soon. And then at the bottom, there is a taste of, we're just about to have accepted or published in the Journal of Pediatrics and Child Health, a review on our findings. Next slide, please. So we really need a great deal of work to do, and it's fabulous to be collaborating with you, Jane, and your team. It turns out that the human health data are simply not used very widely at all in the risk assessments, and that's because it is inconsistent. We now have the evidence for this consistency of association with harm to human health, and we need to work with industry and governments in order to turn the dial. Also, there's a real economic argument here. We simply have not paid the full cost of plastic. We need to factor that in and redesign it so that it really is safe and sustainable. The cost of EDCs alone stacks up to billions of dollars just in the EU. And, you know, it is just an insane economic model we really need to rectify. We also understand, as you do, that the public simply don't know about the effect or the impact that these chemicals are having on their health. And we need to get the message out there to help them to drive change. And we, as consumers, actually have the power of the purse. If we stopped buying plastic that was unnecessary, the market wouldn't be there anymore. Admittedly, there are all sorts of advantages to that with protecting food and the such like. And that comes back to the argument of needing to redesign the plastic so it is safe and sustainable in the first place. So there's a great deal of work to do, and we are absolutely delighted to be collaborating with you and the team. So thank you very much for this opportunity.